Nearly half of adults have high blood pressure, and most of them are told the same thing: lower your salt, take medication. But here's what almost no one is telling you. Blood pressure usually doesn't go up randomly. In most cases, something is driving it, at the level of your blood vessels, your nutrient status, and sometimes even toxin exposure. And if no one has ever assessed these, you're often just managing numbers, not fixing the cause. Hey, if you're new here, I'm Dr. Matt Mason. I'm a chiropractor, acupuncturist, and functional medicine practitioner. Today, I'm going to show you what actually drives blood pressure higher and what you can do to support healthy numbers naturally. Blood pressure is heavily influenced by the health of your blood vessels. When arteries become stiff, inflamed, or damaged, pressure goes up. Low levels of nutrients like magnesium, potassium, vitamin D, vitamin K are consistently associated with higher rates of hypertension, arterial stiffness, and endothelial dysfunction. This just means the inner lining of blood vessels loses its ability to properly regulate blood flow and inflammation, which increases stiffness and cardiovascular risk. This means blood pressure isn't just about fluid volume. It's a reflection of vascular health. Potassium. Potassium helps the kidneys excrete sodium. When sodium is low, what we call hypokalemia, the kidneys retain more sodium. Fluid volume increases, blood pressure rises. Research consistently shows that a higher to sodium potassium ratio is strongly associated with higher blood pressure. Most people simply don't get enough potassium in their diet. So improving potassium intake and lowering that sodium to potassium ratio has been shown to measurably support healthier blood pressure level. This is one of the most overlooked contributors to high blood pressure in modern diets. Vitamin K. Vitamin K helps direct calcium into the bone and away from arteries. So if vitamin K is low, calcium can accumulate in blood vessels. Vessels become stiff. Pressure rises. Magnesium. Magnesium helps relax blood vessels. It's often called nature's calcium channel blocker because it helps regulate calcium movement into vascular muscle, helping support proper contraction and relaxation of the blood vessels. And when that balance is off, blood vessels can stay tighter than they should. Vitamin D plays a major role in blood pressure. Low vitamin D levels are consistently associated with higher rates of hypertension. Vitamin D helps regulate the renin-angiotensin system, which is like the body's blood pressure thermostat. So when your body thinks blood pressure or sodium is too low, it turns this system on to bring pressure back up. So when vitamin D is low, this system can become overactive, contributing to tighter blood vessels and higher blood pressure. Heavy metals. Heavy metals linked to higher blood pressure include cadmium, lead, mercury, and arsenic. These can come from food, water, air pollution, tobacco smoke, cosmetics, consumer products. Most people don't even realize they're being exposed to these daily. These metals can bioaccumulate in tissues over time. They increase oxidative stress, increase inflammation, and damage the endothelium. When the endothelium is damaged, nitric oxide production drops and blood vessels can't relax properly. Some research suggests these metals can even push the nervous system into chronic fight or flight, which can drive blood pressure higher. When we look at blood pressure clinically, three major physiologic systems can drive the numbers: vascular tone, endothelial health, and nervous system regulation. Because blood pressure is ultimately a reflection of how these systems are functioning. System 1, vascular relaxation and blood flow. Nitric oxide helps blood vessels relax. Low nitric oxide means tighter vessels and higher pressure. L-arginine. L-arginine helps the body produce nitric oxide, improving blood flow and supporting healthy blood pressure. Magnesium. Magnesium relaxes vascular muscle and supports vascular tone. Potassium. Potassium helps balance sodium and fluid balance. System 2. Endothelial protection and arterial structure. Tocotrienols are powerful antioxidants that protect the artery lining and reduce oxidative stress that damages nitric oxide production. Vitamin D. Vitamin D deficiency is strongly linked to hypertension and arterial stiffness. Vitamin K helps prevent calcium buildup in arteries. And there's emerging research that's looking at seaweed extracts like rhamnin sulfate for supporting endothelial integrity and nitric oxide signaling to help relax the vessels. System 3. Food-based vascular support. Look, diet is always the foundation, but diet isn't always enough anymore. Even people who eat relatively well often fall short on key nutrients due to soil depletion, food processing, modern farming practices, and increased physiologic demand. Celery. Celery supports vascular relaxation. Garlic supports nitric oxide production and vascular health. Hibiscus tea. About 2 to 3 cups daily has been shown in studies to lower systolic pressure, roughly 7 to 15 points, and diastolic, about 3 to 7 points. Some studies show effects comparable to low-dose ACE inhibitors, and that's just from tea. This is exactly why, in my practice, I focus heavily on supporting the physiology behind blood pressure. That often includes nutrients like magnesium, potassium, vitamin D, vitamin K, nitric oxide support, nutrients like L-arginine, and vascular antioxidants like tocotrienols. And if you want to see examples of the types of supplements I personally use in practice, I've listed those in the description below. So the key points to remember: blood pressure is rarely just a sodium problem. It's usually a vascular health signal. It reflects endothelial function, mineral balance, and sometimes toxin load. When you support physiology upstream, the numbers often improve. If this helped you see blood pressure differently, hit subscribe, because this is the stuff most people are never taught. If you know someone on blood pressure medication, send this video to them. It could completely change how they approach their health. And remember, diet is always the foundation. Supplements are meant to support the body's natural physiology, not a substitute for it. And when you fix what's driving the problem, the body often does what it was designed to do: heal. Stay tuned for the next videos, where we even go deeper in how to support real lasting health.